If I knew this was going to happen, trust me, I would have never gone through with it.
Tonight, more Minnesotans are coming forward to say they were paralyzed after a controversial spinal procedure.
A procedure investigative reporter Lauren Lemanchik found is restricted overseas, but still widely used right here.
Still learning to navigate life in a wheelchair.
I don't hit people. I do hit walls. Ouch.
Despite sudden,
Sorry, but my
excruciating pain.
my back and feet hurt so bad I can only stand it.
Do you need help, Mom? Is there anything I can do?
The result, Judy Palmy and her daughter Kelly say of a medical procedure gone wrong.
Did anyone ever warn you about the risk of paralysis?
No, I don't remember it ever being brought up.
Judy went to neuropain clinics to fix chronic back pain. And almost instantly, they recall, her doctor recommended a spinal cord stimulator.
The actual stimulator was introduced with literature and pamphlets and stuff on her very first visit there.
Spinal cord stimulators are implanted in the spine with leads run up the canal, sending electrical signals to block pain receptors. Medical records show during 2 trial implants, those leads migrated, moved out of position in Judy's back. Judy says her pain doctor still advised going ahead with a permanent implant.
I woke up and then I couldn't feel my legs.
At the hospital, a neurosurgeon found it was likely an injury occurred during the procedure. And Judy will never walk again.
I'm going to wear, they call it a brief, I call it a diaper for the rest of my life. Do you know how traumatic that is?
A woman who'd recently colored Easter eggs with her great-grandkids and cared for her sick husband never returned home.
So the last year of his life, I wasn't with my husband. I was in a nursing home.
She is now suing her doctor and Nora. Judy is one of 4 local patients KARE 11 has spoken with who say they were temporarily or permanently paralyzed after receiving spinal cord stimulators.
The brochure said it was safe.
Linda Mose spoke with us from a rehab facility just 8 weeks after her procedure at Twin Cities Pain Clinic.
About 2 hours after I came home from the procedure, I stood up and had excruciating pain. And within 5 minutes, my legs started getting really weak.
At the ER, surgeons found Linda had suffered a hemorrhage within the spinal canal.
Now I am in a wheelchair for the rest of my life. I'll never walk again.
The use of spinal cord stimulators is growing. One expert analysis estimates 50,000 are placed in patients every year worldwide. But a KARE 11 review of FDA data finds in the last decade, more than 200,000 reports of injuries. And a 2020 report by the nonprofit Public Citizen found spinal cord stimulators had the 3rd highest number of medical device injury reports submitted to the FDA.
We cast the net globally.
That type of data prompted Dr. Adrian Traeger to study the devices in Australia.
We looked specifically for trials that compared spinal cord stimulation with placebo, because we know that's the highest level of evidence we can get.
The result? This groundbreaking report with a surprising outcome.
What our review found was that there is actually evidence now that spinal cord stimulation is no better than placebo. And that really shocked us.
Their conclusion, spinal cord stimulation probably does not have sustained clinical benefits that would outweigh the costs and risks of this surgical intervention. Coupled with evidence of injuries to patients, the Australian government took action. In 2024, pulling more than 12 devices off the market there and restricting new implants of more than 70 others.
Following our publication, they decided to substantially restrict the devices in Australia.
But here in the U.S., the devices remain as popular as ever, and the American Academy of Pain Medicine has disputed Traeger's findings and methodology.
And I think there have been some recent publications, including a Cochrane review, that made some flawed conclusions.
Past president Dr. Antje Bareveld says she's seen success stories firsthand.
Yes, the spinal cord stimulation for the right patient can be extremely effective. And it's really about the right patient and for the right indication.
In Judy's case, Nura has denied wrongdoing. In a statement saying in part, all medical treatment options carry different degrees of risk, which we thoroughly review together with each patient prior to treatment, adding they follow a rigorous process to qualify patients for any procedure. Twin Cities Pain Clinic also said they follow recommended standards of care and review potential risks and benefits with patients.
When people are in pain, you're vulnerable.
But patients living with outcomes like this say the risks were not clearly spelled out, and they were sold hope only to come home in agony.
If I knew this was going to happen, trust me, I would have never gone through with it.
We have heard from multiple patients, and Sunday night I'll have more from a woman who says she was pressured to get one of these devices at multiple pain clinics, even after her neurosurgeon told her it could lead to paralysis. For KARE 11 Investigates, I'm Lauren LaMancha.